Hello, this is John Kanellopoulos from Athens, Greece and New York City, New York. It is my pleasure to send this video email to you in regard to this year's 2015 International Society of Refractive Surgery Subspecialty Day. The ISRS, as you know, is a partner for the American Academy of Ophthalmology, and it holds the Refractive Surgery Subspecialty Day for the last almost 20 years. It is our pleasure this year to have modified the program according to your request and have condensed the traditionally two-day program into one day on Friday, November the 13th. Thus, it will not compete with your gambling activities, no, all seriously, with you attending other subspecialty day meetings in Vegas on Saturday. We have a very interesting program, the new diagnostic modalities for both lens and cornea-based refractive surgery will be analyzed in our first session. Our second session will go over new exciting procedures, inlays, phakic IOLs, the SMILE procedure, new femto and excimer laser technologies. We will then follow with a very popular session of video-based complications and their management in both lens and cornea-based refractive surgery. We will then go to a session that we started last year in 2014 with doctor-patient interactive consultation. In this very innovative session, we have invited two guest physician speakers to play the role, one of them of the patient and the other one of the treating physician, in very hot topics such as which laser procedure should I have, why am I having problems with my nighttime vision, etc., etc. We will then go on to lunch. The lunch session, as last year, will be a members-only working lunch for those of you who have joined the ISRS, and this is a good time to remind you to pay your dues to the ISRS. It's very important to keep this home of innovative refractive surgery alive and robust. The only excuse you have is if you're based in Greece currently. But seriously, there's no gamble in your dues. Enable us to have this landmark meeting every year, which will continue following the special lunch working session with the break with the experts. All participants will get to speak face-to-face with some of the most prominent people in their field in subjects such as collagen cross-linking, phakic IOLs, intracorneal ring segments, intraocular lens calculations in difficult cases, cornea imaging, etc., etc. And then we have the two traditional sessions, one sub-session held by the European Society of Cataract and Refractive Surgeons, the ESRS, with mostly European experts in our anterior segment issues of interest, cornea and lens-based refractive surgery. And we will close, like every year, with some of the most innovative papers chaired by the editor of the Journal of Refractive Surgery, the poster journal for the ISRS. It is my pleasure to be co-hosting this Subspecialty Day meeting this year with Bonnie Henderson of Boston, Massachusetts, who obviously needs no introduction. And I look forward to you not only fulfilling your dues with the ISRS, but seeing every single one of you in Las Vegas in November 13th. I thank you very much for your attention. This is John Kanellopoulos signing out.